So, welcome to the November SHARP information session on community resources for fall prevention. As most of you know, the program has recently changed from health education sessions to information sessions about resources, services, and tools available to help English-speaking seniors to age in the right place. Thank you to all of the Quebec English community organizations and SHARP coordinators and older adults who are here with us today, whose efforts have resulted in this beautiful turnout. If you have any questions about the presentation or the resources provided, please contact the organization and SHARP coordinator or Sharpie that invited you. So I would like to take a minute to introduce you to Dr. José Morais. He is a professor of medicine at McGill University. He is a senior scientist at the Research Institute of the McGill University Health Center in the Metabolic Disorders and Complications Axis. In 2009, he became the director of the Division of Geriatric Medicine at McGill University and the MUHC, the Montreal University Health Center, and the Jewish General Hospital. He is also co-director of the Quebec Network for Research on Aging and is the academic lead of the Dementia Education Program and McGill Faculty of Medicine and Health Sciences. He was the founder and first director of the Center of Excellence on Aging and Chronic Disease. So I'll hand it over to you, Dr. Morais.
Yes, first I would like to thank you for the invitation and for the kind introduction of myself. And so hi everyone, I'm very pleased to be here to discuss falls prevention and the use of the SAFE program. And I have to make some disclosure about the SAFE program that is supported by the Montreal General Hospital Foundation, with contributions coming from the Grace Start Foundation, the Mirella and Lina Sapporo Foundation, as well as Scotiabank. I'll try not to be biased, but you know that we cannot undertake a new program, a new initiative without having the financial support for that. But the aim of this conference is for you to understand the risk factors leading to falls in older adults, so that yourself, you can take some measures to prevent falls, identify measures to prevent falls at home, and we specifically will dedicate time for home environment and how to reduce the home hazards for falls, and also learn about the SAFE program for falls prevention. So these are the objectives. The way that the conference is organized is that I will discuss the impact of falls, the measures to prevent falls at home, the interventions and the role of exercise it can play to prevent falls, and then go over the web SAFE program and videos. I will not present videos per se, but we'll discuss the content of the website of the SAFE program. You know, I'm a geriatrician by trade or by specialty, and in geriatrics we deal a lot of medical issues of older adults, and there is about 10 topics here, 1, 2, 3, 4, 5, 6, even 12 or so, and one of them is in fact falls and dizziness, because it's a frequent complaint by older persons. And this is the topic for today. Many of these diseases are, you know, they coexist, but we have to address each of them when we do a comprehensive assessment. And for sure, one cannot treat all of it, or what I mean, one cannot cure all of it, but we can improve things so that the person will still can stay home and be autonomous in their environment. So why should we discuss falls? First, let's go for a definition. What is a fall? A fall is finding yourself without wanting to on the ground, and this without syncope. The term syncope in medical terms refers to loss of consciousness. So, because the reason is, if you lose consciousness, we should look for the causes of that loss of consciousness that led to the fall. But fall pertains only in the circumstances in which you remain alert, however, you find yourself on the ground. What we should know about this general concept is that physical inactivity and falls contribute to deterioration of the general good health of seniors. And also falls trigger another problem called fear of falling that we will discuss. When I was mentioning about the deterioration of health, mainly is because on a small percentage, about 10%, people do have injuries from the falls. Thanks God, it's just 10%. But the fear of falling that adds to the injuries, it's of a major concern. We will discuss that. First, some stats very briefly. You're probably not so acquainted with numbers and tables and graphics, but the purpose of disclosing that, it is a well-recognized fact that as one ages, the trend in fall prevalence, existence of fall in the older population goes up, as this bar tends to show, since it goes from at 65 to 69 at a certain height, but it goes up when you reach 80 and plus. Another observation in this graph here is that the pale bar, the gray one as opposed to black, etc., is in women. And women seem to have more falls than men in general at any age category presented here. And if you look for the causes of it, women have pretty much about 50% greater risk of falls than men. And when we assess gait in women, what we realize is that they have more gait variability, because when we studied their gait, there is variation in speed and in balance, and these are signs that women are less stable than men when walking, especially during dual tasking assignment. What it means is that as we are studying their gait and we ask them questions about what is going on in politics in the country, this distraction makes the variability to increase, and much more so in women than in men. It's as if they feel less secure, less safe. So in terms of other statistics of interest to all of us pertaining to the province of Quebec, and this is data taken from the Institut National de Santé Publique du Québec, who follow these numbers year after year. In general, there is about 20,000 visits to emergency room every year in Quebec per year due to falls. And the large majority, 3/4, 71% of these falls do happen in persons above 65 years of age. Falls represent 25% of all the emergency room visits in Quebec. For all older persons who come to the emergency room, 25% of them is due to a fall. And despite, thanks God, injuries to represent only 10% from all the falls, it still is a significant leading cause of death in older adults, because it is the 6th leading cause of death after having death from cancer and heart disease and infections such as bad pneumonia or COVID in these days. The 6th leading cause are falls. So all of this tells us that we should be cautious. It's a significant problem in our community, and we should address that, because there is things one can do. We can prevent some of the falls. We should be aware that with injuries, especially with hip injuries, 30% of older persons who sustain a hip fracture after a fall need to be placed in the long-term care facility, which is not something that most people would wish, but it becomes necessary because they lose a lot of capacity and functionality. Okay, to go into more detail about these frequency of falls and consequences, people fall at home. They even fall more at long-term care, and the highest area of falls per person is at the hospital. There's reasons for that. People who are in long-term facilities, they are frailer and they have more issues with memory, general health, as well as in mobility. This is why they are on these facilities, because they have lost their autonomy. And in the hospital is because they are sick, and also because the way the hospital functions with a lot, it's a rapid pace, a lot of changes, moving from bed to go for radiology, x-rays, for tests, this and that, and all of this is a source of falling. The bad thing with falls also is that once an older person fall, there is 30% risk of another fall on the same year. So if you have 100 fallers above 65, 30 of them will have a second fall on the same year. So it's why we should do prevention. Even though only 10% leads to injuries, fractures, or other tissue injuries, such as muscle pulling, as an example, etc. Falls from fractures and injuries represent 85% of all hospitalizations for injuries. You can have a car accident, etc., but 85% of all hospitalizations for injuries is due to a fall that can be preventable. And from all the hip fractures in older people, 95% is consecutive to a fall. Again, that can be preventable. From the type of fractures, thanks God, hip fracture represents only 2%, but it is a serious threat to health because it's a major cause of placement, as also of increased mortality. Other bone areas, this is arm, wrist, and pelvis, it represents 5%. Internal organs injuries, as well as brain bleeding, that we call traumatic brain injuries, which is very serious as well, represents 10%. So whenever there is fractures and injuries, is not trivial, but thanks God it's a much lower rate overall as a consequence of falls. But let's do as much possible prevention of falls. By the way, it has been estimated that all the falls taking place in Canada causes about $2 billion of costs every year in Canada. So you can understand that, because it's a combination of the cost of being hospitalized, the cost of receiving rehabilitation, the cost of being placed, but also sometimes is the impact on families. Because when someone falls and cannot get up from the ground, you might need to call the ambulance. A family member might need to stop the day work to come and help older parents because they cannot stand from the ground. All of this comes with costs, and this has been estimated, and $2 billion a year is quite a huge sum of money. Now, more specifically, why are we falling more? This has been studied and published in a report by the World Health Organization in some years already, but also being reproduced in a report that McGill and I contributed to produce for the World Alzheimer's Report in 2022. And these risk factors are distributed in 4 categories: some behavior factors, some environmental factors that we'll discuss in more detail, biological factors, and some social economical. So it's quite broad and large. In terms of behavioral, consider that sedentary lifestyle is a contributor. Our muscles and joints and bones need activity to be performant. If you become too sedentary, I mean, they atrophy and you lose the capacity to mobilize with easiness. But also sometimes is the fact that you are not wearing appropriate footwear, or you have drank a bit more, or you're taking risky activities that you should not have, because we don't have the same rapidity of movement, the same dexterity to do certain tasks as when we were 20. And we have to have this type of judgment to not engage in activities that we have not been doing for many, many years, such as in men, taking the ladder and trying to clean the roof when it's raining. You know, it's slippery. So if he loses a little bit of balance, he may not have enough time to recover his balance, and he's going to find himself falling with consequences. These are examples of behavioral. In terms of environment, sometimes we take risks in our homes because the floors are slippery. They were just waxed, and we forget about this fact, and then we sleep as there is the presence of loose rocks, for example, or walking in the dark. Sometimes we are too lazy to consider turning on the lights or taking precautions and have a low intensity light lightening the floor so we know where we are walking if we wake up during the night, or on the streets, you know, having uneven sidewalks. We have to be careful, or obstacles on the ground, or slippery sidewalks, which happens often in the spring here, in particular in Canada. In terms of biological, we cannot deny that with age, there is more chronic illness, our performance goes down. Some of it we cannot change, but some we can. And this is why we are responsible for our own health, and we have to make sure that mobilizing is a safe thing, and we have the responsibility to maintain a certain degree of activity to stimulate our joints, our muscles, and then be autonomous. But as one age, you know, chronic diseases affecting the brain, the presence of arthritis affecting the joints, contribute to that increased risk of having falls. Even people who are malnourished contribute to muscle weakness, for example. And when we assess them, we verify that their muscle volume and tone is adequate for age. There's a condition called sarcopenia, which means lack of muscle mass and strength. We address this so that we can prevent some falls by assuring that through nutrition and adequate level of physical activity proportionate to the age is implemented. And finally, we cannot neglect the fact that in general, people with low income, who are socially isolated, that don't have close accessibility to community service, who has low education because they understand less their needs as they advance in age. All of this contributes to fall. So it's quite an array of causes that we have to address when someone comes to my clinic because of a fall. Now, amongst all of these factors, some are more stronger than others. In general, and this is what is presented here in these bar graphs that are horizontal, the longer they are, the more weight they have in causing falls. Okay, so in general, someone who is above 80 has, I would say, 1.6 to 1.8 more chances of having a fall, so an increase by about 80%. Cognitive impairment, and this is one of the questions at the beginning of the talk, the conference. Also, cognitive impairment and dementia also contributes to fall by increasing by 60 to 80% as well. Feeling depressed increases the risk by 100% more, so it doubles the risk. It's why it crosses the line number 2. Obviously, if you have significant visual deficits, it increases the risk as well. So I advise you to make sure that your vision is as optimal as possible by having annual visits to your optometrist, and if need be, refer to ophthalmologists. So the fact that someone requires an aid for walking, this is a cane, this is a walker, it also increases the risk by 2.5 times. If someone noticed that his balance is not as it used to be, persons feel very unwell and they don't feel safe and secure when they are walking. They feel wobbly. This also is a sign that they have gait impairment, and the risk of fall increases by 2.5 times more. A specific disease of the brain called ataxia, in which there is a lot of discoordination of the movement, increases the risk also by that same magnitude of 2.5. Any previous fall history is a risk factor for announcing a new fall again. That's why 30% of people fall have another fall on the same year. So it increases the risk by 3 times more. And the strongest risk factor for falls among all of those mentioned is muscle weaknesses. And this is something we can reverse by having a good nutrition and doing some regular exercises that are acceptable for the person's age. So we have to address muscle weakness, and without exercise activity, we cannot solve that part. In terms of medication, that was another question. Certain medications lead to a risk, okay, of falling. For example, if you take diuretics, it increases the risk of falls by about 40% more. Diuretics are medications that sometimes, in most cases, in fact, is justified. But a person taking diuretics should be careful in not falling, doing things appropriately. One of the protection mechanisms is by, upon standing, take a few seconds before start moving, or upon from bed, lying in bed to a seated position, stay at your bedside for 10-15 seconds before rising to allow the body to adjust, because the diuretics pushes water off the body, and it takes more time to stabilize all the fluids distributed in the body. Sleeping pills, as it says by definition, makes you sleepy, and even after a night that passed in bed, because the clearance of the medication from the body might take more than just 6 to 8 hours. As a consequence, your reaction time, if you are sleepy, you are slower. You have less stimulation, less stamina, and this increases the risk of falls. Taking some antipsychotics, the same, anti-epileptic and antidepressants, especially the old type of antidepressants, but even the new type. New types for depression can be associated with falls. Now, we have to consider that these are serious medications, usually prescribed with and justified. It's just that we have to be cognizant of this, so that we can take precautions not to fall if we are taking these medications. further increased risk is from opioids or narcotics. These are strong painkillers. And we hear about young people taking fentanyl and other narcotics that are derivatives of morphine that can even lead to death because it interferes with their state of awakening, being alert, and can decrease the rate of breathing to the point they stop breathing and they die. So I'm not trying to scare you. What I'm trying to convey as a message is that narcotics, because they have an impact on the body, increases the risk of falls by 60%. And if you have a combination of different drugs, if you're taking more than 4 drugs in general, we call that polypharmacy, then increases the risk by 75%. And I have to tell you that having 4 drugs, it's common in people of 80 and above. Again, medications can be justified and necessary, so please don't stop them unless you discuss this with your doctor, physician. But you have to be aware that it has an impact in your capacity to mobilize and increase the risk of falls. So in this graph, it is described where do patient, oh, sorry, I say patient because I'm a doctor, but where do persons fall? And 50% of the cases in a report from the Public Health Agency of Canada is at home. So it's not on the streets or doing some sports, is at home. And so if we could have an impact on the home hazards for falls, we could then decrease the rate of falls and its consequences. So a lot of work has been done with suggestions being made to improve home safety for falls prevention. And this is usually done by someone from the community service. Most of the case, it is an occupation therapist that does a home evaluation and tries to identify where the problems are. But a lot of them are many of these risks are self-evident if one is cognizant of the association between falls and the situation in question. So make sure that you have dry surface in the bathroom, you know, around the tub when you take a shower, etc. Because wet floors is a cause of falls. For persons who have poor balance, because it does happen, unfortunately, that some of us lose their balance to the point of walking with a lot of assurance, let's say, then it is recommended to have bars being installed to assist in you standing up safely, you know, or even trying to sit down in the toilet bowl. And obviously, it is the responsibility of the person who installs the bar to make sure that it is well in place and well anchored. So for those who are having a lot of leg muscle weaknesses, then some adjustments can be done on the height of the toilet seat so that they don't need to be too low to sit or trying to stand from the toilet. Same thing for having access to the bathtub, where we can put extended seats where a person sits outside of the bathtub and just slides in to be able to take a shower without the need to raise their legs high enough to go over the bathtub sides. And also be very careful in the bathroom to always have the floors dry and remove any spills of water as soon as you notice it. In the living room and bedroom, make sure that there is not too much impediment for you to circulate around. We tend to accumulate a lot of things in our homes, and so reduce the clutter. Sometimes without noticing it, we have a lot of wires and cords from the phones or for extending for a light in, in the room in question. So we have to make sure there's no obstacles for one to circulate easily, especially because as we advance in age, the capacity to elevate the foot from the floor becomes more demanding. And this is why older people adopts the habit to shuffle rather than elevate the foot. So a suggestion is to have cordless phones, and this is something very true, is avoid rushing to answering the phone or answering the door when the bell rings. Many falls happen because we change our habits under pressure to answer a phone call, to answer someone knocking on the door. Go at your own pace. If you are meant to use the walker, do it with the walker or the cane rather than rushing without aid, which is a source of falling. At any time in the house, day or night, have proper lighting to see obstacles, to see where you are walking on, you know. And so we discussed clutter already to make sure that the path is clear for it, especially during the night. People fall a lot during the night because it's not properly clear the path or the lighting inside of the area. Again, rugs and mats are another source of falls, especially in older people, those with already gait impairment who do not elevate their feet. So we have to make sure that there is no tripping hazards in the way. And again, the other thing of doing it at your own speed, your comfortable speed when you try to do things, walking, standing, don't rush. I think that is an important message, because going outside of your usual comfort zone to answer a phone or to answer someone knocking on the door is a source of falling. In the kitchen, make sure that everything is at easy to reach, not too high or if possible, not too low either, because requiring to have a stool to climb on it to reach for pots and pans, it creates already a risk, as well as having to bend very low to get them from the cupboards. So make everything accessible at a comfortable height for you. Other things that, again, the kitchen also, as in the bedroom, are more it happens more often to have spills, and do not leave any water on the ground. Please clean it immediately. And also the use of very waxy floors that makes one easy to slip. And if you are requested to do a task that it's risky task, you know, look for help instead of trying to do everything by yourself. You might say it's easy to say, but I don't want to disturb my kids. I don't want to disturb my neighbor. But, you know, frankly, we all realize that we need each other. And there is nothing wrong of for an unusual task to ask someone to give you a hand. And most people feel very happy to give a hand to someone else. So this is the different precautions we need to take in our own house, because 50% of the falls happen at home. Okay. Now, is there evidences that if I modify the environment, if I decrease the risk of falls, does it work? In general, the answer to this is yes. This is a complex table, and my intention is just to make proof that it works. For example, interventions in general decreases the rate of fall by 26%. So a reduction of 26%. For those people who already had previous fall, so they are at higher risk of having more falls, then the interventions in the home is even more significant. It reduces the risk of falls by 38%. And this is mathematically proven to be significant and to be reliable. But if you try to intervene in the house in someone who has not had falls before, or doesn't show signs of being at risk to fall, modifying the hours doesn't make much of a change. This is why in the not selected for fall risk in studies looking at this specific type of situation, then the intervention in the house doesn't change anything. So we have to have good reasons to make a change in the house. A reason for it is, as soon as you change the habits of the person, without a purpose, or change the environment, without a real need, then it's even worse. Don't do anything. But if the person is at risk to fall, and after an evaluation of the house, there is things to be improved, then it's worth doing it. That's the message I would like to convey to you. This so-called fear of falling, we have to discuss this, because by definition, fear of falling is by definition here, is a persistent concern about falling. A person is afraid of falling, and because of that, the older person avoids to do activities, whereas they should be able to. It's just a concern, a fear, rather than the true situation of being at high risk for falls. Okay, and believe it or not, about 30 to 50% of older adults, who live independently in the community, in their homes, they have some fear of falling, which can retain them from doing activities and initiate a vicious circle that is presented in the graph or the drawing in the right side of the screen. As you can see, after having, let's start at the level of a fall on the top. A fall is conducive of loss of balance, confidence. You start doubting about or stable you are. Then you become fear of falling. Then you restrain your activities. Then over time, there is a reduced muscle strength and worse balance. Then your gait becomes even more unstable. And then you really have an increased risk of falling, and you fall again. And this is a vicious circle. What impact on daily activities? And it's also known that women have more fear of falling than men. I'm reporting here at the bottom the association, between fear of falling and the problem of worsening mobility, of difficulties in self-care activities, and in household activities such as cleaning the house, preparing the meals, amongst other things. You can see that for each of these items, mobility, self-care, and household activities, there is three lines, a green one dotted, one that is red, and one that is blue. The blue line signifies, in the study, signifies people who had one fall prior to studying their mobility. The red one is people who had more than one fall. And the green dotted line, green one is for people who are fear of falling, even before having sustained any fall. And if you look in mobility, you can see that the green line, people over time, from year 2, 3, 4, 5, they have impairment of mobility, even greater than those who already had experienced a fall. just because they are fearful. In terms of self-care activities, this is being able to take his own shower, getting dressed, grooming, feeding, and moving in the house. Same thing do happen. Those with fear of falling has as much difficulty accomplishing their self-care activities than those who had experience of fall already. Remind you, at the beginning of the study, they were selected for not having difficulties with self-care activities. Same with household activities. So it is as if by fearing of fall, we already are contributing to decrease their own autonomy. So we have to overcome that, because there is tremendous consequences. First, your gait and mobility will worsen just because you are afraid, and then it will have an impact in your autonomy. So how can we approach that? It's a combination of psychology and exercise, I must say, because we have to make the person realize that their fear of falling was not justified, okay? But also they need to feel have a perception in their own body of being safe. And this is one of the benefits of exercise. Forget all this complex number. And because this is a study looking at any study being published in literature to tell us, can exercise improve the fear of falling? And the most important aspect here is that row here, where there is this legend, this diamond shape figure, telling us that exercise, in terms of decreasing fear of falling, decreases the fear of falling by 56%. So it's quite significant. Just exercise, as assessed by questionnaires called the Falls Efficacy Scale, is an internationally used scale to measure your fear of falling. So the fact that you undergo exercise decreases your fear by 56%, the fear of falling. So exercise is useful. It's why it contributed in my mind to develop the SAFE program that soon we're going to be discussing. Because physical activity, exercises in general, has tremendous benefit to the body, okay? And this is common knowledge. It's why I'm not even putting any reference scientific papers. It's so much recognized that I can say this and without having to make proof of it. We know that exercise, physical activity regulates appetite, something of concern in older people. It promotes a healthy weight to avoid obesity or even to avoid to be too skinny, because exercise maintains muscle mass, reduces body fat, maintains the muscle, as I mentioned, improves your heart and breathing capacity. And when we are engaging in regular activity, walks or something even more demanding, but we do it regularly, 3 times a week, etc., it reduces stress and improves sleep. All things that we are looking for as when we age. we would like to feel have better quality of sleep, an appetite that makes one feel healthy and eat adequately, etc. So this is all benefits from physical activity. And people in general, we are more physically active, have less heart attacks and strokes, develop less diabetes, they have less depression, insomnia, anxiety. Bones are stronger, so they have less osteoporosis. They develop fewer cancers. They live longer in general, and they enjoy a better quality of life. So we are all invited to be more physically active according to one's capacity, but engage in something, because there is clear benefits. It's better than any other approach we have, including medications that I prescribe. Exercise is more precious and more efficient than my pills. Do I have proof that exercise works to decrease falls? In general, we can say that exercise of any type, because these different type of exercises that I will address soon, decreases the rate of falls by a quarter, 25%, 23%. Okay. So, for example, the studies conducted in a total of 12,000 people, almost 13,000 people, have shown to reduce 195 falls compared with 850 in those without exercise if they followed 1,000 person for 1 year duration. So it has an impact, and so let's be physically active. The impact of exercise can vary depending on the type of the population. It's less effective if you already have had a previous fall. But if you have had a previous fracture, it's helpful as well in a significant way, but less than in other conditions. It does not affect going to the hospital for a emergency room visit after a fall, but it decreases visits to the family physician. So if you go to a clinic because of a fall, by being physically active, you decreases by almost 40% less need for visits to your physician in the clinic. With all of this knowledge, I decided to build a program for people to engage in exercise, having access to internet, because I wanted to have something available, and this started just a little bit before the COVID. I was already planning it, but certainly with the COVID, where we had reduced in a substantial way our mobility, going out and meeting people, etc., it gives even more incentive for me to finish this program, because the purpose was to improve or promote healthy aging in the population, allow people to become more autonomous and to continue living at home, reduce the falls, especially with specific exercises that have been shown to decrease by an average 40%. This is more than 22%, and you will see why some type of exercises have a greater impact than just any kind of exercise. So we created a program called SAFE. Is a free home-based website. SAFE stands for Senior Adult Fitness Exercise, but there is more than exercise. But let's discuss exercise first, okay? So it is a series of exercise video that the aim is to improve mobility and prevent falls, okay? There is 4 levels of difficulty. For every type of exercise, there is 1 to 4 levels of increased difficulty, and it has 5 types of exercise, so 5 different categories, and each of them with their 4 levels of difficulty. And these are, as we always should do, start with our warm-up period. This is advised even to young athletes. You cannot engage in physical activity without a prior warming, because tendons and joints, they need to be prepped to undertake extra effort. If you don't do that, this warm up, then you end up creating damage, developing tendonitis, developing tears of the tendons or the muscles, you see, and then you're going to pay the price. So warm up is suggested for everyone, including young athletes. After that, there is 4 types of categories that you can undertake after the warm up. There is exercises for increased strength, which is needed for those who are who suffer from more weakness. There is exercise to improve balance, which is needed, balance and coordination. There is exercise for flexibility of the joints, because we need to loosen up our joints, and also exercise that will request more endurance. And we need that too. We need to have a good cardiovascular system to make one going to a certain distance in walking. You should know that SAFE has no password, is easily accessible, user-friendly, easy to navigate. You don't need to subscribe. You have no need to pay any expense. It's as they say, it's turnkey ready. So the selection of these exercises were based on clinical expertise and research. Some are my research, some is programs that we have available here at the Montreal General Hospital in our geriatric rehabilitation program. So you know that doing these regular exercises will overcome the limitations associated with sedentary lifestyle. And can be done in your homes by watching these videos and imitate and follow the suggestion by a moderator, a trainer that is there. You can see in this picture here a patient of mine who accepts to be videotaped doing exercise, and she's supported by her daughter. And you know, I have seen them afterwards, and they both report that it have increased the bond between them because they can share things together. So being physically active can reduce the impact on muscle loss. That is a major cause of weaknesses, and improves your balance, your functional capacity, your autonomy. It's all kinds of ways of preventing that we become more weak and frail, you know. So why is it good for seniors? You have a lot of exercises in the web. If you have access to internet, you just ask for exercises. Everything, it's so many. But these ones were specifically for older persons who want to maintain their autonomy, okay? You can use it at home. The exercises, you can navigate them. You can go, for example, if you find that your balance is the worst component of your stability for walking, so you can do the exercises pertaining to balance. And it's recommended to do the 4 different types categories after the warm-up, but you can, for example, realize that you're more deficient in strength, and your joint flexibility is perfect. So then you can adjust the videos to spend more time or do more frequently exercises on strength and do less on flexibility. So you can adjust and personalize the content. And do not forget ever that along with more assurance, more confidence, you resolve so many psychological benefits, including reduce the fear of falling, improve your sleep, even get rid of some negative thoughts and depressive mood, and will facilitate interactions with others. You will be more prone to go out and benefit from life, improve your quality of life. Here are depicted sorry, it's bilingual on the description of the exercise, but below is the text is in English. So warm up. Why? I'm just trying to justify to you why we do these things. So we do a warm up because it really loosens your joints and activates your muscles and prevents injury if you engage in more activity. Then there is strength exercise because we all need to overcome some degree of weakness that you might have. And all of this will make not only more strong, but also more functional. Yeah? In terms of balance, a major topic related to falls prevention in older people it's so important to maintain the balance, perform, feel stable, and improve coordination. This is why some type of specialized exercises addresses that. And one of them is Tai Chi. I don't know if you ever heard of Tai Chi, but because you do these movements in slow and maintaining positions, then you will really improve your balance, which has an impact on falls. So flexibility is needed for you to move with ease, such as dressing, bending, and reaching. Usually it's done with low impact flexibility exercises that were designed as part of the video exercise program. And endurance, as already mentioned, because it enables you to be more performant for longer without feeling short of breath and tired after doing a few steps only, you know. Reason I'm showing this table is just to show to you that doing this type of exercise in our geriatric day rehabilitation program at the Montreal General, we have had tremendous impact in different domains of mobility and function, you know. An example, just look at the last column to the right, clinical meaningful improvement. This is more than just having results with numbers. This is the number of people that had a significant improvement in the tests. Bartel, the first one of the tests, is a test. In fact, is a questionnaire on your facility in doing your activities of daily living. You know, we achieved 46% of the people felt there was a significant improvement, and that the results showed to be significant. Same for instrumental activities of daily living, which comprises activities such as cleaning the house, doing the groceries, preparing meals, going outdoors, and take public transportation, amongst others, include also finances. In any event, 47% of the people got significant improvement. Time up and go is a test for mobility of walking, gait speed. 6 minutes walk test is a test for endurance, you know, and near 60% of people improve in a significant way in the 6 minutes walk test. Berg balance is an assessment of the balance, and about 50% of people had a significant improvement. What this means is not just improve, but improved in a significant way. This is what it means. And same thing to do with strength as measured by the end grip strength, and even quality of life assessed by European quality of life 3 dimensions. You know, whereas 46 or near 50% of the people really said that their quality of life has significantly improved. Voilà. And based on literature, because what I just presented is results of the rehab program we have here at the Montreal General, but based on literature, if you do a exercise that is of multi-type, what it means is exercise addressing balance, addressing function, addressing resistance or strength, then instead of achieving a reduction of falls by 23% as previously shown, the impact of the reduction is at the level of 34%. This is almost 40% that I say that the SAFE program can achieve. And if you look at the bottom on the table here, in terms of the value of reduction in falls, Tai Chi is close to 20% reduction of falls, and it is mediated. First, Tai Chi is considered to be a multi-type exercise intervention or activity. It combines a lot of balance and also resistance, because you have to maintain certain positions for a couple of seconds, or extending up to 30 to 60 seconds. So you work in different modalities, things that the SAFE program address. But the SAFE website contains also other informations on recommendations for older adults, useful resources, and then the videos, as you know. So I advise you to access the web for those who have internet access by just typing safe-seniors.com, and they can have access to a lot of resources as well as the videos. And it's for everyone, not a particular type of older person. Anyone can have access and enjoy the program. Specifically using the program, I received recently a master thesis result of a master's degree kinesiologist named François Lepage. He just sent me these results to show that there was a significant improvement in the Tinetti test, which is a test of risk of falling, on the Berg test for balance, on time up and go for speed and mobility, chair standing, capacity to stand 5 times from the chair, up and down less than 15 seconds. 6 minutes walk test for endurance, and also answering a questionnaire called the Fall Efficacy Scale International. All of this was significant. In other terms, SAFE can help people improve these tests that should lead to less falls. I am doing my own study with a large number of persons. I have no results yet to show you, but this is just preliminary results. And voila. So if you access the website, you're going to see the different levels of difficulty based on color in the lower row here, whereas level 1 is reddish, level 2 is yellow, then bluish, and green, level 4, which is more demanding. And the picture on the top is the different exercises that is requested from you, and that you can imitate the trainer that is there, with a lot of explanations given. For example, you can see the arrows indicating what is expected for you to do by moving, what direction, what height, and the number of repeats. And there is even a clock that says if you have to do 10 repeats, it says first 1, 2, 3, at a pace that is amendable to seniors. Voilà, this is what I wanted to present today on this month dedicated to falls prevention. Thank you for your attention, and I am now available for questioning from you.
The first question is about the fact that there's a lot of falls that happen in hospitals and CHSL days. And the question is whether you think that the staff, the fact that these places are understaffed plays a role in the increase in falls.
Yes, it's a combination of many factors, but we cannot deny that there is lack of staff also. And staff that is a bit trained, knowledgeable in the risk of falls in older people, so that they can intervene, they can preemptively protect the person from falling. But also the population that is hospitalized, the population that is in long-term care, they are more frail. You know, they have more intrinsic in the interior of their bodies. They are at higher risk to fall. So yes, but the other factors is also lack of staff and support. Yeah,
absolutely. That makes sense.
The cluttering, you know, if you ever go and you visit a long-term care facility, you see so many things in the corridors that if the corridors would be more
less
cleaner and less cluttered, it would be a big difference.
Absolutely. Okay, we had one person say, what can you do for quadricep muscles that don't work? That actually, like, this person, I think, experiences falls that occur without advanced notification. And they're wondering if there's any medical devices that might help with this.
Yeah, I mean, yes, there is. But I tell you something, that is amendable, accessible to all of us, is walking.
Mm.
And you increase your quadriceps strength by cycling, let's say, but also by doing repetitive movements of sitting and standing.
Sit to stand.
Yes, you also improve your muscle quadricep by taking stairs, you know. And this is what we call functional exercise, because it corresponds to our daily needs. Also, what you can do, even being seated, you can improve your quadriceps strength by attaching a little weight on your ankle and lift your leg to become straight from the seated position. Seated is 90 degrees. By making it straight this way, and with the weight attached to the ankle, so increasing resistance, increasing the weight on the leg, you are exercising the quadricep. Quadricep muscle is the one leading to extension of the leg. In fact, it controls the knee. Is pulling the knee, so you make the legs straight. So by doing this type of exercise, sitting in a chair, trying simply to move the leg from 90 degrees to about 180, then you are practicing your quadriceps. You also need to, so the pelvic girdle muscles, your buttocks, your hamstrings, etc., should be exercised as well. And there is on the strengthening component of the SAFE program exercise, we deal with that. Yeah.
Okay, that's really helpful information. One of our senior wellness centers senior wellness center coordinators wrote in saying that she knows at least 2 seniors who have been tripped up by their pets, by their animals.
Yes,
their dogs
another risk factor. I mean,
yeah,
anything in life, accidents do happen, right? Accidents do happen.
Yeah,
So
exactly.
yeah.
Are there can you think of any solutions for this that don't necessarily involve just getting rid of the animal?
Yes, train your animal not to go in front of you.
There you go.
We are too kind with our animals, and we allow them to do certain things. But if you go to a school of training animals, they insist that animals should not be ahead of you, but by the side. And you can solve a lot of risks there. Yeah.
Absolutely.
Yeah.
Okay. Excellent. There's one more question that came in, and I'm curious to see how you're going to answer it. I think it's a tough one. What happens when exercise doesn't work and you're still falling?
Yes. So, falls can be very complex, and the success rate is not 100%, is 40%, is, so you have to have recourse to the assistance device for mobility. Be careful in your movements. There are people more prone to fall because they are more distractible, more impulsive. You have to be cognizant of these limitations that you might have and work on them. Go more slow. Really follow the advices of upon standing. Don't rush right away, but wait a few seconds for the equilibrium in the different functions of the body is reached. When we are younger, these dynamic adjustments takes place right away. As we advance in age, these functions, these protective functions, then take longer to function, to install, and then you have to give the time for the body to adjust.
Absolutely. So exercise is one component. One component of fall prevention.
You have to work in psychology as well, like the fear of fall. It's also a confidence that you have to develop.
That's it.
Yeah.
And all of the other things that you said too, like
all of them,
reducing clutter, all of those different things. Yeah, that makes
sense. And eating well, being well hydrated, being rested by improving sleep if possible. Remove medications that can delay your reaction time, can make you more sleepy, less aware, all of this. You know, it's a multi, and in fact, I didn't present on it, but when you address falls, you need a multidisciplinary team.
Yeah.
You
Absolutely.
need people with different expertises working together to propose a plan, you know.
I just want to say a huge thank you again, Dr. Morais, for being with us, for your excellent presentation and shared insights about why we don't want to fall.
Yes, no one wants to fall.
The risk factors, the fall prevention strategies. I especially like the section on specific rooms in our house. You know,
Yes,
that's really
yes.
relevant for aging in place. And this wonderful resource that people are already saying they're going to be using in their senior wellness
Yeah.
centers and at home. So thank you so much for being here. Thank you also to all of the senior wellness centers and seniors who were here as well and engaged with the presenter and the topic, and to Shannon for the technical support. And thank you again. Have a great rest of your day, and we'll see you in January.
Thank you for the invitation. Bye, everyone.
Thank you so
Take
much,
care
Dr.
now.
Morais.
Bye.
Take care.
Thank you.
Bye.